Oh, wow.
Ladies and gentlemen, welcome to the show. I'm Dr. Larry Burchett, and we have a very special guest here today, Dr. Michelle Thomas. Thank you for finally doing this.
You're welcome.
I've been looking forward to this for a while. Dr. Thomas is an ER doctor that I work with in the Central Valley. She's going to tell her story, and I am hopeful that for those of us who work a lot and work hard, I think there's some messages in here for all of us, me included, to learn from.
Yes.
So welcome to the show.
Well, thank you. Welcome. Thank you.
Let me start with this. So what got you into medicine in the first place?
Well, I used to watch Marcus Welby, MD, and Quincy.
No.
Yes, those reruns. I was a little girl. I grew up in Tulare, and I used to watch those reruns. And I wanted to be just like Marcus Welby. I wanted a bag. I wanted to go and help people. I just thought that was pretty cool.
How old were you when you first remember this?
I don't remember.
Like 6 or 10 or?
May have been around 6, and maybe around, I was young because those were all reruns.
Yeah.
Those were reruns.
What was it about that show that you liked?
Quincy did a lot of cool things. I mean, Quincy was a pathologist. So
I don't know the show.
Quincy was a pathologist, and he was almost like a pathologist that go out and solve crimes, And but he would work with the body, and it was interesting. I loved Quincy. And in Marcus Welby, it was different. He was a country doctor, and it was just, for me, that was something that I just really liked. But I also wanted to be a rock star, and I also wanted to be all those other little things. But I was drawn to medicine.
Did you?
I was drawn to
So
it.
was this like you're 6 or 10 and you're like, I want to be a doctor, and it was that the whole way? Or did you try being a rock star for a while, or what?
I tried singing in the back of my parents' car. I tried it. I tried all the stuff that kids do. But in 8th grade is when I had to put a timeline together. One of our instructors asked, where do you see yourself? And we put these timelines together. And I know on my timeline, I was supposed to be married at a certain time, have X number of kids, live in the country. I was going to be an OBGYN. I don't know why I picked that.
In 8th grade.
In 8th grade, I don't know why I picked that. But I also liked law, and I liked those things. So I decided that, I'm going to just try to pursue whatever, in college, and.
So you had some other interests besides medicine, like law, and then in college, did you take some pre-law stuff, or how did you?
I took one course and dropped out. For me, it was boring. I was not going to memorize all these cases, and it just didn't fascinate me.
Yeah.
Like science fascinated me.
Okay, so we're back. So you were talking about how you first got into medicine and got interested and went to high school and thought about law and stuff. And I can identify with having wanted to do medicine since I was a kid, since 5th grade. So how did you explore that?
Well, in high school, actually before that, my parents encouraged us to do pretty much whatever, we really wanted to do within reason. They were very supportive. My dad was a salesman for more business firms. And my mom was a stay-at-home mom, and she actually was our school assistant, as you recall. She would go to our different classes and just help out. And then we moved from the Valley to Dublin area, in the Bay Area. So both parents had to work
from
at that time.
From the Central Valley
up to the Bay Area.
Okay.
So both parents had to work at that time. Different environment and whatnot. I'm the oldest of 3 children.
Okay.
So I'm the only girl. And my brother, who is 2 years apart from me, and then my other brother, who is 4 years apart from me. So we all moved up there, and it was just a whole different culture, a whole different environment.
How old were you when you moved?
Oh, goodness. I know I was starting 6th grade.
So like junior high.
Yeah.
Okay.
So I was starting 6th grade. Very much different culture. Because coming from the country, Central Valley area, to more of a city area, it was different.
Kind of suburban, Dublin, suburban Bay Area.
Exactly. And it wasn't as built up as it is now. and I still wanted to be, something in medicine, something. I was actually the caretaker for my brothers when my mother went back to work. So after school, I would pretty much walk them home and then take care of them until she got home. Then when my dad got home, sometimes starting dinner, things like that. But I was also active in school, very much active. And then during that time, there was a pilot program in our high school. It was called Career Links. I was actually looking for the office where you could work and go to school when you're in high school. Yeah, you can work and go to school. You had to be a junior.
Why did you want to work and go to school in high school?
Because I always wanted to pretty much be independent. And I was independent. I had my first job at 8 years old. I threw papers for the Valley Times.
So you were a go-getter.
I was pretty much a go, and still are, very much so. And my mother would get up with me in the morning time because my dad would, sleep because he was the breadwinner, and she would get up. They would throw the papers, pretty much throw them or put them on our porch. Sometimes, but most of the time, they were throwing these bundles at about 3:34 in the morning, and we were rolling them. And I had one of those carrier things where you stuff the papers in the front and stuff them in the back, and literally walk around the neighborhood throwing papers on the porch.
You had a paper route.
I had a paper route.
Wow.
And I just wanted to have, that money. We weren't well off, but we weren't poor like we were in Tulare.
Yeah.
We were middle class, and this whole different neighborhood culture when we were up there too. And my brothers also were very much involved in being independent and doing things at school. So for me, I always carried that. I was active in everything. I was in band, and in band, I wanted to do cheerleading. So I did band and cheerleading.
So you're very active, had all these things going on. Working, going to school, activities, taking care of your brothers.
And multitasking, to me, it was just part of what we do.
I'm already, just listening to what you did in high school, like part of me is already feeling kind of overwhelmed, like, whoa, that's more than I would have wanted to do.
We kept busy. I was in band reviews, and in the band I was color guard. So sometimes in our band reviews I had to choose between being in the marching band as a clarinet player or doing the color guard. Didn't really go over well with the instructor, but it was no limit. I was also in student government, so I was there early in the morning. I was president of my class for 4 years in high school.
Oh, wow. You ruled.
Yeah, pretty much. It was interesting. It was a dynamic time for me. So, it was kind of different because a lot of things were changing at that time. The culture was changing, and our high school went from over 1,200 students down to almost 800 because boundaries were changing, because race was changing, and it was not a good time.
When was this?
This was in the 80s. I graduated 86. So in the 80s, some of the things were changing. There wasn't too many people of color in our. Like
Dublin was integrating more?
Yeah, it was very much integrating, and there wasn't too many people that like that. So boundaries were changing. A lot of our students were going over.
That was hard, probably.
It was very hard. Some of my friends actually had to be bused over to Pleasanton schools, Amador and Foothill. They actually had to put out those trailers.
Who was going over there? This was like segregation?
Not like segregation, but more of when they changed the school boundaries to say you live in this part, so you go to this school, you live in that part, you go to this school.
But this was racially motivated?
Yeah, it seemed that way. It really did.
In the 80s?
I
was like, you're not from the 60s.
No, but my parents lived through that. We also had, at that time, outside lockers in the schools. They used to have those outside lockers. You have freshman, sophomore, junior with the lockers, right? And in our lockers at times, we would open it and flyers would come out. And those flyers were either advertisement for skinheads, sometimes derogatory things. And I remember our principal, Mrs. King, at that time, we would also have these, what they would gather everybody into the gym, and we would have these talks, and spirit rallies, things like that, because of this. And I seen they would come down Village Parkway, I think it was at the time, and you would see like a Ku Klux Klan, things like that.
In the 80s?
In the 80s, they would have their parade.
In the Bay Area.
In the Bay Area. And it was sad, but that's what happened then, and that was my experience, you know. And I was fortunate to be class president for 4 years. My
in that setting, wow.
Yeah, my classmates chose me, and it was nice. My best friend Pam Lucas was she was valedictorian. She was the vice president. So it was a changing time, and at that time I was still interested in medicine.
Well, I was going to say, how did any of that affect your career desires or what you wanted to do?
Well, I really focused more on science. I was always loving science. I loved biology. I liked the things that we did in our science classes, so I knew something science related was for me. And I went into this place called Career Links thinking that, I'm going to get that, you know, job and you can work and go to school because now I'm a junior and I can do that. And it turned out it was called Career Links. They were basically place you in an environment of your choice to see if you like that career. And they made you take this long test. I'll never forget this test. It was like a personality test. And mine came out and the lady said, "You like science?" So I'm like, "No, duh, you know." Yes, I do like science. She said, "We can place you there."
Did it spit it out and say, "You should be a doctor"?
No, just science.
It just said science.
And I told her I was interested in OBGYN. I wanted to know. And they said, "We can place you in the field." And I was like, "Really?" And they said, "Yes." I said, "Well, what about just in a hospital?" And they said, "Yes." They put me at Valley Memorial Hospital for 6 to 8 weeks. And I was working in the X-ray department. So at that time you had films, like real films that you can, you know, develop and things like that.
I've heard of those things.
They showed me. I was around with the techs. I came there after school. I came there on weekends. I was basically like their intern, and I saw a lot of things. I conversed with the radiologists, and I kind of liked that, but I knew I wanted more. So at the end of that, I was like, I want to hang out with, you know, one of the OBGYN doctors.
So that was a good experience, and it kind of, you wanted to do some more.
And they placed me there. There was another person in my class that wanted to be a DJ. They placed him at a radio station.
Yeah.
I mean, people had different aspirations.
That's good.
So it was really good. So I ended up doing...
it's good, especially before, because like when you get to college, and it's good earlier to get as real of an experience of it, so you know what you're making a decision on.
Exactly.
Instead of just being, I want to be an OBGYN because I watched it on TV, which is great when you're a kid, to really get real experience, so you know that you like it more than that.
I saw my first delivery because I was actually working in the newborn postpartum ward, my second go around. And then I tagged along with one of the local GYNs. And he called me one day. He actually called my mother one day and said, "Hey, is she out of school? Because I'm going to have this lady, we're going to do a C-section." My mother rushed me down there. They got me dressed and everything. I scrubbed in. The nurses got me dressed. I was in that room, did the C-section, watched the water come out. It was funny when the water came out. I didn't realize how emotional I was. I'm standing there, and next thing you know, I'm against the wall because I'm backing up the whole time, and tears are just going because it was just so emotional. And I'm like, I want to do that. It was just really nice.
So I'm wondering, like, how did you go from this wanting to be an OBGYN to ER?
Well, actually, when I went through med school, I was picking and choosing. Now, it was nice to be OBGYN, but I knew there was other things out there. So during my rotations, I was like, wow, I really liked the heart, and I really liked cardiology. Because you like a bunch of different things. So. And I realized it's just process, the time. People need to realize what they really like, what's fitting for them. I mean, for me, I'm spiritual, so I said God has a plan for me, and it might not be OBGYN. It might be something else. I like delivering the babies. I like that. But there was other things that came with that. Prenatal care, there wasn't always a good outcome. You know, as you experience all that throughout med school, you try to find your way. And I thought, wow, after 4 years, I thought, surgery. Way from GYN. Surgery.
Oh.
I wanted to do surgery. And I think it was because I just felt that, you know what, it was challenging. And it was, wow, you know, it wasn't delivering babies. And it wasn't primary care and family medicine. Because at that time, I said, I know there's more. I can do all this. And I've seen my attendings to all that, you know, from assisting to delivering to doing this. And I really like surgery. And the group of people I were hanging around with, it was like we were just gunners. So it was like, I can do
surgeons,
that. I can do that.
So you kind of decided you wanted to do surgery at the end of med school?
Yeah, pretty much towards the end, when we were trying to match. So
Okay.
I just knew it.
So did you match surgery?
I did. I went to
Oh.
Martin Luther King Hospital.
Oh, you went to MLK.
I went to MLK. And my best friend and I were at MLK. She continued along.
Which is funny because I work at MLK now. There's no surgery, there's no residence there like there used to be, but they want to get it back again. But
Yeah, it was a very good experience, you know?
So what happened? So you started surgery. Are you a surgeon?
No, I'm not.
What
I decided
happened?
after 2 years, I went through the program. I
Yeah.
went through it and I decided along the program that this is not really what I wanted to do. And
Why not?
through that, I am more of a family person. I have family obligations as well. And my family, I didn't have children. I wasn't married at that time, but I'm very strong with my family. And they needed me as well. And then I decided that the lifestyle that I saw my attendings and people were doing, I did not want to spend a lot of my time in school. I really wanted to be a CT surgeon, if anything.
Yeah.
And cardiothoracic, I just loved it. When I did my rotations at Harvard, UCLA, it was,
Yeah.
I loved it. But I did not want to be that fellow at 30 or 40 or so.
You didn't want to be in residency that long.
I didn't want to be in there that long, and I knew I had family obligations. You know, for me,
To your brother, your parents.
to my aunts, you know, my aunt needed help with my cousin, and I'm not saying I had to do it,
Yeah.
but I felt like I needed to be there, and I knew that I did not want to be in residency that long.
Yeah.
I did not. And I said,
It's so
well,
long.
It's long. And
I mean, I did
said,
family, which is 3 years, and by the second year, I was like, "Get me out of this." And it's only 3.
3, that's it. I know. And I went to ER and did some ER, and I really liked that. It was like you do a
So you
shift and you're
did 2
done.
of surgery, and then how many? And then you switched to what?
I actually took a year off. I started to just work so I can regroup and figure out what in medicine I would like to do. I actually did a locums, some traveling with a 2 locums company. And I wanted to figure out what to do. One of the ER attendings, who I love dearly, so she gave me good advice. She says, you know what? There's a locums company. At that time was Interim Physicians out of Berkeley. And she said, go around and see what is in medicine that you'd like to do. And I said,
What kind of locums did you do?
I did primary care. So I
So
traveled.
2 years of surgery residency, you had a license, so you could do some primary care locum stuff. Okay.
Yes, I joined one from Utah, one company from Utah, another one from Berkeley. And the one from Utah, Vista, can send you different places outside of California. One from Berkeley really was just for intra-California. And I wanted to travel. I wanted to see what medicine was like in other places, what other physicians were doing before I settled, you know. And I enjoyed it a lot. It was a lot to see. I met a lot of different people, different practices. You know, it just kind of grounded me. And of course, I made money, which was nice.
Not a bad thing.
And I can see people getting lost in that. But I also know I wanted to be boarded in something. So I said, you know what, with family medicine,
at
I
that
can
time,
do this.
could you have just done locums for?
I could have done locums for a long time. I met a lot of physicians that did locums, and that's all they've done.
Because I feel like
You know?
now we have to have, well, at least to work in a hospital, you have to have boards and all of that, and be residency
At least
trained.
board eligible or whatever. And you have to settle. And there was a lot of docs out there that I met that, I don't want to say a lot, but a few that I met that said that's all they did. But I felt they weren't grounded.
Yeah.
And I knew I wanted to be grounded at one point. I needed to have a family.
Grounded
I needed to
meaning?
be grounded. Meaning
To a
I needed to
location
settle
or
to a location. And I wanted to have a family.
Okay.
And my family needed me too. And at this time I was, still taking care of my cousin. Actually, I brought him places. And then, it was just nice, And
So
that.
at the end of this locums time, what did you kind of learn about yourself and what you wanted out of medicine?
I knew that God had a path for me, and I knew that medicine was my calling because I couldn't see myself doing anything else. And
You had thought maybe I'll get out of medicine.
I had thought about it.
Okay.
I thought about it, but business, law, all that just did not interest me.
What was it about medicine in that year that you kind of connected with that calling?
I felt I can save the world. I can save the world. I connected with people and I helped people, and people were grateful, even for just talking to them. You
Make
know?
a difference with
I
patients.
made a difference.
Yeah.
I made a difference, and they made a difference with me because we're people, and I learned a lot, different culture. I saw a real hillbilly.
Do you remember any specific stories from that period that?
I remember a place called Union, West Virginia. And
Oh, you really did travel.
I did. I went to Union, West Virginia, and it was way out there. And it was this little clinic. And when you first get there, the locals company, they had a dentist pick me up, and he took me to his home, you know, with his family out in the woods, pretty much. And it was a beautiful home. And then they had a guest house, which had no curtains, just all windows. And I'm out here in the country with all this, and it's dark in the country. There's
I'm just no offense. I'm laughing at you in West Virginia. I'm having a good time with this story.
Yeah, I did too. The first thing I said was, "Where is a hairdresser for me out here?" And Union was a small town. Literally, you can get off the main road, go around one road, and come out the end of that road, get back on the main road. That was Union, West Virginia.
Wow.
That was it.
Small town.
It was a very small town. And on the top of this hill thing was a clinic. And so I went to this clinic and I met the other docs there. And it was just nice. Everyone was so friendly. They were just as surprised to see me as I was surprised to see them. Had one African-American person in town, and he was a vagrant, which was kind of funny. I even took a lipoma off of the mayor. It was, at least that's what he said, he was a mayor.
Nice.
He came in, it was like everyone was coming in to see the new doctor and to be treated by the new doctor.
Because you were probably better than whatever they had.
Maybe, maybe not. I mean, there were two good doctors there. I met two great doctors there, and they were more laid back, down home, and I just liked that. It wasn't academic. It was more of a, we're here to help people. And people would pay you. Okay, they would come in with moonshine. They would have, you know, they had food, but no, they literally, they were patients of the clinic. So it was nice. And I was invited to the women's, there was a get together one time, and it was invited to that, and they had a lot of good food. And there was a guy that was from upstate New York who's a chef, and he had started some restaurant in town and can just cook. He cooked so well, and everybody went there. And then he closed down for a certain time, and then he had dinner, which was really nice. It was a very small town. It was nice, and that was a great experience for me, because at that time I think I was into the Real World. Remember Real World on TV?
Oh yeah.
I was just started.
MTV's The Real World.
MTV's The Real World, and I knew they were in West Virginia. They had been in West Virginia and did some cannonball, and I really wanted to do cannonball. I wanted to jump out of a plane with someone. And I really did. I wanted to get off the 6th. I wanted to skydive. I said, I'm going to do all this stuff because I went through high school, went through med school, I went through this, and I just wanted to live a little bit, you know. And I didn't get to do it. The pilot got sick. But I ended up doing a whitewater rafting.
We should have sent
nice.
some cameras with you to West Virginia.
I had a blast. That was a good experience. I went to Kennewick, Washington. It was a great experience. All the places I learned something from my patients, from the people I worked with, the environment, from me, just learning what I can do. You know, I was timid in medicine when I first started. My first job was in Merced at a clinic. And I was very timid. I grabbed all the books that I had from med school and put them in my car, this little hatchback, because I was
totally
like, oh,
did that too
you know.
on my first job.
Yes, because you don't want to miss anything. You want to make sure.
It's your anxiety that you're dealing. It's I'm safe with these books.
Exactly.
The answer's in the book somewhere. If I can't figure it out.
Use them. You know. But I did have a great time doing that, and that's when I decided that I needed to go back into residency, because I needed to settle, and I wanted to be in the Central Valley. I didn't know I was going to be in the Central Valley, but I wanted to be somewhere where my family was. So it was either going to be back at Davis or in Central Valley, and so I applied to Davis Family Medicine Program, and I applied to Central Valley Family Medicine Program.
And why did you pick family after that year?
Because in family, you can do anything and then settle on a few areas. So it's not like
you liked having options.
I like having options, and I still like having options, and I like that. And I was like, I can do this, and I have experience.
Have you? So after residency, have you done different things?
I sure did.
Oh, yeah?
I sure did.
What all did you do?
I actually did OB with a local physician who's now
you did do
expired
some
here.
OB.
I sure did. I loved it.
How long did you do OB?
I did OB for...
Because this is what the little girl wanted to do.
That's right. And I enjoyed it, and then finally said, "That's all." You know.
How long? How long did you do that?
I think 2 years.
Couple years.
2 years, because I was in a nonprofit group at first.
And then why did you move on?
No, I had a child, and the hours just was not for me, and I didn't
Delivering
really have
babies
support.
at night or being on call and that kind of thing.
And just carrying,
kind of lifestyle
and have to worry about where am I going to put him. You know, if they call me, where am I going to put him?
Yeah.
Where am I going to,
Yeah.
I didn't want to. And after a while, I didn't want to be waking up at night anymore. I was already woken up at night with a little one. I didn't want to do that. Not then. And then I thought, you know what? I am going to do some clinics. I did some work with some of the clinics out here, United Health Center, different places.
Kind of primary care, outpatient stuff.
But it was still just not that. I mean, it was nice, but it was just that felt like you're doing a lot and getting little satisfaction. I needed to do something with my hands. I didn't want to lose my skills. I had some skills I really didn't want to lose. And one of my attendings said, "Hey, why don't you do some work at this local hospital I'm at in the ER?" And I was just like, "What?" I work in the ER. I want to work in the ER, and I did it. And I got it. It was very intimidating because I was like, I'm all by myself, and
scary.
And it's the ER,
Yeah.
And I thought, when I got into it, I was like, this is my element because I loved it. I said,
Why did you feel like it was your element?
It was natural to me. I CPR. I did. I put in lines. I put in lines in residency when I was a surgeon.
So you liked the intensity. You liked some procedures.
I like that, making decisions on the spot, focusing on what needed to happen then.
Yeah.
And that's it. Not on, can I see this person in 2 weeks? Can I see what we needed to fix right then and there to save this person or to get them back to where they need to be, or sometimes we just couldn't.
Yeah.
But you needed to make that decision right then and there. And that adrenaline, for me, was a rush.
I don't like the adrenaline. That's not why I'm in the ER.
I like the adrenaline.
It's a big lie. I like it too, for sure.
And a lot of us do.
Yeah, for sure.
And they have to admit that, because that's nothing to be ashamed of. That makes you. And
that makes you feel alive.
And you touch that person, and something about that. There's a reason that you come into contact with people. There's always a reason. There's always a lesson. And that's how I look at it. Usually, people look at it, sometimes people go, oh my gosh, I got 3 more people to see. Well, we feel that way sometimes, but they're there for a reason. I'm learning something from that patient's learning something from me. And when it's appropriate, I've learned over the years that, some of my experience for this person may help them. And what I've been through, I can probably identify in some way. And that will help them. And you touch their lives just for that little bit. You don't have to be in primary care to do that. It's just in medicine in general.
I think it's so true. One patient at a time and focusing on what I can do for them. That being kind of the meaningful space. Not how many did I see today or how many big things did I do, but like
how much time did it take me to see this person?
Each one, like just one at a time,
Because that time they spend with you, you do not know where they've been. You do not know what it took to get them there. You do not know. Because their problems might be bigger than yours. And what you say, what you do, can impact them. And I've learned that over the years.
Sometimes you never know.
Because I've been a patient, and I'm a mom. I'm a brother, I'm a sister, I have brothers, and
You've been on both sides,
I've been on all sides.
All sides of that.
And so I know at that time that you can have big impact, and without even knowing it. So, and I've had people come back to me and say, I just had a nurse practitioner that is practicing here locally, that I seen her in our ER, and she was a battered female with 2 kids. And what I did for her touched her. She changed her life. She was able to leave that person, and now she is a nurse practitioner running her own clinic.
Wow.
And I didn't know that. It was years ago. And one of the nurses here said, "Hey, you remember this lady?" And I said, "What lady?"
You probably
and they
wouldn't
told
even
me,
remember.
I didn't even know. And she says, "Remember, she was here. Her name is this, and she was here, and she had." And I said, "Oh my gosh, I remember that." And I was like, she said, "Yeah, she's a nurse now, a nurse practitioner." So it was, you just never know.
Let me take a break for a second. So tell me about this. Tell me about the story.
The health story. We need to learn how to take care of ourselves. And that took me a while because I'm used to taking care of everyone, people. But taking out to take care of yourself. You're telling people they need to take care of yourself. They teach you to tell people to take care of themselves. And, I needed to learn how to take care of myself because I was trying to be everything to everyone. And couldn't.
You grew up taking care of your brothers. But I mean, and you did all these thds, but did you not take care of yourself?
For a while I did, because I liked to work out. I actually did some sports. I was in softball when I was little, and I did all of that. But I didn't continue to do that. I was so focused into now I am doing medicine and I'm working, and now I have a child. And then my mother moved from the Bay Area here to help me, and she retired, so she started living with me. And then now I'm taking care of.
So were you taking care of her?
She had her own means, but she lived with me, and she took care of my child, and she opened a daycare in my home. I bought my own home. So I had to take care of the house.
What are all these kids doing here?
Like, never mind. But did you cook? So I had to learn. I had to take care. I had responsibilities, and I had to do that. And I love to travel and buy things because you make money when you're doing at that time when you're out. So I had to learn how to take care of myself. And I wasn't doing that. I was taking on one job. And then I'm working with a group, and I decided I'm going to work this many shifts. And then, can you work this much? Oh yeah, I can do that. If I had free time, oh, I can do that. So not learning to say no, because my family started to suffer when I didn't learn to say no. Oh, I'll just go work these 12 and I'll be back.
Because you were doing so much time you were working.
That's right.
So not only you and kind of your physical health, but then time, you weren't spending enough time with your family.
That's right. And I was just so into it. And sometimes I think about cases and how can I take care of this person or whatnot, because I was still off hours or something. People would call me, and friends, things like that. So I would think, I'm trying to be everything to everyone. You can't do that. You have to take care of yourself, and especially if you're telling people to do that. And after a while, I decided I want my own practice. And I decided I'm going to need my own practice, and I'm going to do ER to help supplement that. And I did that for a while.
So for a while you did ER only.
ER only.
How many hours would you average?
Oh my goodness.
In a week,
it all depends.
At that time?
I just remember in the month we were doing 120 to the max I've done is about 180, almost 190, hours.
And then what about when you were doing you had your own practice and ER?
I decided, let me settle a little bit and let's do my own practice, because I thought I can get more by doing my own practice.
Okay.
So I started it from the ground up, signed myself up for the different insurances.
Oh my God.
I went out and looked for buildings. I talked to other people who were in practice that were actually retiring. Should have gave me a clue, but retiring. And I wanted to do that. And I wanted to do house calls because I saw a need, not just in my own family, but other people who needed a primary care doc. So I thought maybe I can just do that too. And I have my skills at ER. Let me do that. That'll give me more time with my family and up here. But my attitude was, my gunner attitude kicked in after a while. No, I'm going to admit my own patients. No, I'm going to do this. So I did admit
I'm going to do it all
patients.
myself. I can do it all.
Yes, I can do it all.
I don't want anybody else. Kind of the
I actually
do it
got
alone.
people to help me. Because I do know that I needed my other colleagues to help. It's not like I just want to do this because inpatient care will suffer. So no, I needed other people to help me. If I can round, and if I need someone else to round on my patients, I can have that too. That was opportunity because hospitalists were around at that time too.
Okay.
And I needed to be there in the office for my patients. And sometimes if I needed to close the office, then reschedule, I can do that. I also hired nurse practitioners that I worked with to come in and fill in to make sure my patients' continuity of care.
No, I just want to kind of reiterate this because I can see each step of the way what you're describing makes total sense. You know, you're like, I got in the ER and I felt alive and I really helped people, you know, and then I wanted more and I saw a need, so I responded to it and opened my own office. Like that makes logical sense to me. And at the same time, I just keep feeling more, like when you tell part of these stories, I'm like, how are you going to do that?
Yeah. And you do it. And when you say you can't do anymore, you don't do anymore. You can't so I knew my limits, and I worked with some really good people. So we conversed, we were a team. And so it really helped. And then one day I said, I can't do this anymore because I am telling people to take care of themselves, showing them how, getting them to the right specialist and taking care of them. But I'm not taking care of myself as an example. And I had diabetes.
Walking the talk.
That's right, walking the talk, but not doing it. And I said, you know what? I have diabetes and high blood pressure. And high blood pressure and diabetes run in my family. And I'm gaining weight. I'm in a size 24, 26. I'm getting a big woman, and I'm eating at fast food restaurants, and this is not healthy for me. And so I made that determination, but I also didn't look for the signs, didn't see the signs that I was having some issues because
what signs?
The signs of chest pain, shortness of breath. I just attributed that to my weight. And I was going to the gym, and I was going with friends to the gym and things like that. Even some, telling people we walk. Some of my patients, I walk with them. And I was getting short of breath, and I was having chest pains, and I just attributed it to my weight. And then... I'm out of shape. I'm out of shape.
Right.
I'm just out of shape.
Oh, I haven't exercised enough. I need to do a little more, take care of myself. I need to get, And that's where I said, okay, I have this balance. Now I have to get this balance. So let me, get more in shape and just cut down on some things, cut down on some shifts. And how old were you at the time? Can I ask?
I was 38. And at 39 is when I had a heart attack.
I think most of us, wait a minute, say that again.
39, I had a heart attack.
39.
I was on shift in the ER in Selma, and I actually had chest pain. It was a night shift, and I was going to the back because it has slowed down, and so we typically had a place in the back where the physicians can recoup and whatnot. And I sat in that lounge chair, and I must have dozed off, and I was woken up by the phone. Because nurses will call you when there's something happening, because you're not too far, you're like a couple feet away. And then they call, and I guess I dropped the phone, not knowing I dropped the phone. I had felt something in my chest, but I just figured it was because I was yawning or sleeping with my mouth open or something. I wasn't sure. But one of the charge nurses came inside, and she saw me, and she said I didn't look well. Took my blood pressure was elevated, and then long story short, I got admitted to the hospital and then transferred to the heart hospital. And then from there, I had a stent placed in my main, in the LAD.
Did you have a STEMI?
It didn't show as a STEMI.
But you had an abnormal EKG
abnormal
or something?
EKG. I believe my CKs were high. They said my troponins weren't that high, but my CKs were high.
But you got a stent in your LAD.
I saw the before and after. Before, it looked like it was almost closed.
Like a 99 or something.
Oh my goodness, yes. And the after, it looked like it was open. It was open,
That is, to hear LAD, the widowmaker, the widower maker, that at 39, that's so scary.
Yeah, it was. And that was when I said, I need to make a lifestyle change.
I bet.
A whole lifestyle change. And I did. I made a lifestyle change.
I want to get into your lifestyle change. I just want to say this again. You had a heart attack on a shift. while working in the ER. That's crazy.
Yeah.
And you were 39. Yeah, you had some risk factors and family history and stuff, but I think about so many providers that probably push it like you do, like you did, don't take care of themselves, and are older, probably with more risk factors.
Yes.
This
And
is
they're out
real
there.
for us.
And they realize it. Some of them realize it and just poo-poo it, you know. For other reasons, maybe they have obligations, maybe financially they're not where they want to be, whatever.
I want to talk a little bit about like when you had these symptoms, were you in denial or were they just, I mean, I don't know that I would have picked it up either.
I was in denial. I think it was more of I'm out of shape. I need to slow down and go to the gym. I'm just out of shape.
Yeah.
So that's what, I did. And I had a friend of mine who was also a patient of mine who was going through some things, and we decided to take a boxing class at Gold's Gym, and that's what we did. And that's when I was really having symptoms, was I couldn't get up those stairs.
This is like a couple weeks beforehand?
It was like a couple months before.
A couple months.
I couldn't get up the stairs. I was running up the stairs in the gym and down the stairs and back to the classroom. And I was like, wow, I am just really tired. I'm really tired and this hurts. But I was stoked and I really wanted to do it. And, I needed to lose weight. And that's why I said I'm just out of shape. I even gotten a personal trainer, the whole 9 yards,
39.
39.
Okay, so then what? So you get one stent
And
in your
I said,
LAD.
it's time for me to lose weight. It's time for me to lose weight and slow down. Because I need to be around. God has plans for me. Otherwise, I wouldn't be here.
Yeah. How many kids did you have at that time?
At that time, I had one. I had two. I had just adopted Cameron, my son.
When you say I want to be around,
I had to be around. I had to be around for my kids, for me, and for people who depended on me. And also, God had a plan for me, and He still does. Medicine's my calling, and He has a plan for me. So I knew that if He wanted me at that time, I would not be here. But there's something I needed to do, and there's still a plan for me. So I needed to get myself in shape. He's telling me something, I need to get myself in shape. I need to have a balance. And I talked to colleagues, I talked to a pastor, friends, because you need that balance. And people keep you balanced. So I needed to find a balance.
Tell me what that balance looks like for you, kind of contrasted by what it was before without it.
Right now, the balance is I know when to say no, and it took a few years, but I know when to say no and set boundaries. Need to set boundaries. I knew how much to work and how much not to work.
So number one would be saying no, setting boundaries, like how many hours you're going to work per week or per month.
What shifts I can work. How many shifts I can do in a row.
Because you try not to do night shifts.
I try not to do night shifts because I know on night shifts, for me, it's unhealthy for me.
Do you ever do night shifts?
I have. And the group that I was with before decided, there's some people that can do night shifts, some people that can't. And I was wanting to do that.
Night shifts, but I'll do them.
Yeah. And some people can do it.
Okay,
I know for me, I couldn't do it. I couldn't do it.
So how many in a row for you?
If I had to do a night shift,
not night shifts, but just regular.
I can do 4 in a row.
And then do you say no more?
No more. I tried to do over that, and I can do it, but I know for me it's too much. And I do not. My attitude when I walk in, my attitude has to be a good attitude. I have to be empathetic because I can set the tone in the emergency room. I set the tone, and I know that. And that's our responsibility. We set the tone. We can't come in with personal things. We can't come in with attitudes. We have to set that tone. And we're human. It's going to happen, but you have to try not to let it happen, and go with it, because then everyone else around you, your team depends on that, And so it's good to have a good team. You're not always in control of that, though.
So if you do more than 4 or your limit, how do you know that it's too much?
If I'm tired.
So
and my family will suffer.
You're physically tired. What else?
My family suffers. because I'm still their mom. I have 4 children now.
Okay.
Adopted 2, had 2. I'm still a single parent.
Oh my gosh.
I still help with my mother, but she works. She actually doesn't work, but she's living in a different home.
So you still got a lot going on.
I still have a lot going on. No. And that won't change responsibilities. I don't care if you're male or female. The thing is I am the breadwinner and I have that responsibility and I take it on. And I'm not ashamed of it. I just have to make it work. And I make it work. And I have to find time for myself as well. If you don't find time for yourself, things are going to suffer. Your family's going to suffer. Your finances are going to suffer. Your patients are going to suffer, and you don't want that. So I find time for myself.
What do you like to do for yourself?
I like to just walk. Sometimes I like to just sit in a place for myself and just watch people.
Watch?
I will people watch. It's in my car.
Like where? Like a coffee
Starbucks,
shop? Yeah.
Or in the park. I just like people watch, I like to have a little time for myself. And I do like to go to the gym, but sometimes I feel like I don't want to be at the gym. I can do that on the outside. I can walk, I can do this, whatnot. I had a personal trainer. I had personal trainers for many years, and I chose that personal trainers because I needed someone to drive me. I needed to know that someone was depending on me to be there.
Yeah.
That's right, and I needed that. And so I said, well, I'm gonna go, and they taught me as I'll go in there, and it was just so much fun. And kickboxing became my thing because I can get that aggression out. That's right. I'm there.
I'm sure I don't make you mad.
No, but
Kick me in the teeth.
I like to be energetic because I'm energetic, and some
You
people
always seem to
question
me
that.
like you have really good energy.
Yeah, very
Except
much
that
so.
one day that you woke up at 3 a.m. and watched that movie with your kid.
Yeah. Moana. My 2-year-old loves Moana, so I get up and I have to make time for them. Yeah.
So tell me more about the kind of lifestyle changes that you made after this heart attack.
Well, I decided then that I needed to do something to keep healthy. I was getting on a treadmill and I couldn't do the treadmill. I was heavy, I need to do something. So I actually took it upon myself. I would go in, I joined a gym that was on my way to work. So there was a gym in this place called Selma, and I would literally go 2 hours before my shift to go to that gym. So I can do something before the gym, so some treadmill or stair, whatever, so I can have my energy.
Some cardio.
And go in. That's right, and I felt good.
Okay.
I felt good. The cardio stuff.
What do you mean? You had energy?
I had energy. I felt like I accomplished something,
Yeah.
and I knew I had a goal. I had to set the goal out here. I said, okay, I know this goal, and I didn't let people in on it. I just needed to make some changes for myself. These are personal goals, and I needed to make some changes, and I needed to see that the weight comes off. I'm already happy when I walk in there. No one needs to know. It's me, and I'm going to have a great shift. My thing every time I wear, we're going to have a great shift. We're going to have a good day,
I could use some of that someday.
I do that. People say, why are you so energetic? What are you taking? Nothing. I just need to great shift.
Let's bottle that.
Inside, I may feel like, but the thing is, I'm there to do this, and
that's part of your mission.
It's part of my mission. I'm there to do this, and that's what I need to focus on. And after that, I go focus on me at home, because I know in the evening time I need to be mom and a daughter.
See, that's what you did beforehand.
Okay. And then that went, and we're human, that kind of.
And you lost a bunch of weight.
I did. I lost a bunch of weight, and then you gain it back.
How much are we talking?
At first, I don't know. I think the most I've lost was first time maybe 40, 50 pounds. I wasn't where I wanted to be.
Yeah.
And then, I wasn't where I wanted to be, and it was fluctuating. So I decided, you know what? I'm going to look into the gastric bypass, because I do not want to.
Did you have a bypass?
I sure did.
Oh, I didn't know that.
And I didn't want to be diabetic on insulin. I was already on some pills that I didn't want to admit that I could take. But I was thinking that kind of thing.
It's hard to lose weight with diabetes.
And I went and saw one of my colleagues here, and he was right. I needed the Roux-en-Y. And that
you had a Roux-en-Y? Wow.
Roux-en-Y. And I actually only took the 2 weeks off to have it.
Wow.
I didn't do the whole full week. So I knew if I was at home, all I can think of was this: I needed to be busy. and I wanted to be busy. So, and I couldn't afford to be off with that group. I had a group that wasn't that understanding. So I actually did it over the Christmas time. I said in December, I'm going to have the roux wine. I'm not going to eat the cake.
Your boundaries.
That's right. I challenged myself. I'm not going to eat the cake. I'm not going to do this and do that and nothing. It's Christmas time. Lots of food. Here, you know, lots of food.
For sure.
Family, but I couldn't eat.
Lots of good food too.
I was on a liquid diet right here, and I did well. When I went back to work, they accommodated me. You know, for the shifts that I had, we had some short shifts and long shifts. I did short shifts, and that worked out, and that kept my mind off of food. I had a trainer, and he kept me in check as far as keeping up with, you know, workout, trying not. He says, nope, you did this for a reason, and I lost 110 pounds.
Oh my!
I went down to a size 10.
Wow.
From a 26 to
How long ago was this?
10. December 2012. I had 12. I had the gastric bypass.
Almost 5 years ago.
Yeah.
Are you still diabetic?
No, I'm not.
So you're not diabetic anymore. That's
my
great.
labs look great,
So
except
your
for
health
anemia.
is way better.
Except for anemia, which goes with gastric bypass and you know, iron
pernicious
absorption and things like that. Yeah, so I do get some iron transfusions, but my focus, you know, is there. I mean, it was great. You know, after that, I decided, you know, this is working, and so I got my kids into it. Lifestyle changed for everybody. At home, with me,
Mom,
for everyone. We exercise, we walk. We didn't sit around, watch TV, and eat. We eat, and then I go exercise. My daughter, especially, she would go to the gym with me. We had a private small gym with trainers, and I would bring my kids with me. You know, that they didn't have the bigger gyms have an issue with that, but the other one, no. If I can't bring my kids somewhere, then where's an issue? Because I'm already working.
what kind of things do you like to do now for working out?
For working out?
Yeah.
Ride my bike. I finally got my clip-in shoes.
Bicycle. Oh, you're a cyclist.
Yeah,
Huh?
I had done a century one time too, in 2001.
Oh wow.
And I loved it with team and training.
Cool.
Yeah.
What else do you like to do for
Here.
exercise?
We like to walk a lot. My daughter's doing cross country, so she's getting me to run with her. So we run. I walk, run, she runs.
Walking, riding your bike. You lift?
I do like to lift.
You know I want you to lift.
I do like to lift, but I haven't been able to lift the last couple of months. You know, I haven't actually went into the gym and started lifting. I would go in, get on the treadmill, put my ears on because that is my winding down, and I'm dancing on the treadmill. I don't care who's around me.
How many times per week do you usually exercise?
It's about 2 to 3 times now. It was more than that, but it's about 2 to 3 times.
Now, what would you say, like, food and diet-wise, have been the 2 or 3 most important things for you that's helped your health?
Not eating late at night. That's why a night shift's not good for me. I tend
Late
to
at night
late
eating
at night
for
and
weight
stress
gain.
eater.
Okay.
I know that my personality is a stress eater. So that is what I knew before I had the surgery, and I had to come to terms with. A lot of things I need to come to terms with, and I think everyone needs to be honest with themselves before they do something and know where they're at, what things. You know, I like sodas. Now I've slide back into the Pepsi realm because here at the hospital they're free, but I don't buy them at home. But I said, nope, those are empty calories.
We can structure that a little bit to charge you $10 per Pepsi.
Per Pepsi.
But I can identify with what you're saying, especially when you're on. I used to do 24-hour shifts in the ER, and at night, the only way I could go to sleep, because I had all this adrenaline, was to eat the junky food that was around to kind of get a carb load and knock myself out. And so kind of similar stress eating, I noticed this pattern, and that's a great way to gain weight and not.
And a lot of the food in the hospital is not as healthy as you think.
Junk.
It's junk. And so taking the time to make your food, Now, when I had that much time, now I have 4 kids, I make their food. I do that. And sometimes I'll just put something together. But I'm cautious. I'm conscious at what I can choose in the cafeteria. And believe me, some of that stuff is so good. Like they had nachos the other day. And I was like, oh my God, But I was like, I can't get that nachos. But I can take 2 or 3 from the scribe. But I can't get the nachos. I have to get this and fruit. Just a little bit, But I had to. You have to make those choices. It's hard. Every day you make those choices.
Yeah.
Every day. And it's hard. It is difficult because you'll go back to old habits. And I was going back to old habits, like everyone, I have to back off, but you have to realize that, And so I was going back to old habits, and I gained a few pounds. And now I say, okay, I need to go back because I'm not going back to where I was. We can't go backwards. We have to go forward, So
it makes me think about this wellness thing we talk about with a problem and a dilemma. Problems you can fix and they go away, but this stuff never goes away.
No.
Lifestyle and balance and taking care of ourselves and eating and exercising and all that.
And it's good to have support. I have support. I have emotional
who supports you? What's your support system?
My mother is my support. My brothers are my support. My kids are my big support because I don't want them to go through the things I did.
How old are your kids now?
I have a 17-year-old, a 14-year-old, 2 boys. Those are the 2 boys. And then I have a 7 and an almost 2-year-old, and I need to show them an example. And so they need to see that mom can do this. If she's saying you do this, my 14-year-old is into working out, eating right, and he's playing basketball. So he's the one that we take to the gym. And that's why I say I go with him, to the gym. Sometimes, not all the time, because he likes to do other things, But I go with him so he doesn't feel like he's by himself. And he's out there playing basketball in the front yard, he's doing all that. So I'm like, I'm glad I instilled those things because they saw me do things too. Yeah. My oldest one, now he's the junk food eater, but he's got a head on, his head is right there. He is involved in Bible study. He's involved in robotics, things
kid.
like that. And so I try to be at those things as much as I can. If I can't, then I try to be that mom that helps. Like I'll call the youth pastor. Do you guys need dinner on Sunday nights? I can get that dinner. I did dinner for them Sunday night. I was working, but I called in that order, because I want to make sure after work I go get him, pick him up, from there. So sometimes my day doesn't end because I want to make sure it's not that I can go home and just go right to sleep and someone else can pick them up. Maybe my mom, maybe a friend. But I want to be the one to get them to here, get them there. I don't want them to think my job came before them. Yeah,
priority.
I want them to know that I can be there for them even when I'm tired, because I'll get that second win because they're my future and
they're important too.
That's right. They're not going to be around me for their entire life. They're going to leave, So I need to be a part of their life. So it's my 17-year-old who's like way over here now. Mom, I don't need you. Yeah, too cool.
He's too cool.
Got his own life and things like that. But my other ones, they need me.
Some of the things that I've heard from you that are the most important, your family is a big one, especially your kids, your faith, and then work, kind of, the mission of what you're doing and your work. So I get it.
Because medicine I don't know what else I do besides medicine. I just don't.
You're still in the right place doing ER now.
And I love the ER. I love it. Some days I go, why did I do this? Because it's so busy. Oh my goodness. But then I'm like, did I do that right? Did this person okay? You think about it.
We're kind of always a little paranoid. Yeah.
Exactly. But I love it. This is my work family. And I can see it. And I learn something every day.
Yeah.
I learn something every day. And I like being a preceptor, because I'm helping others come up in medicine.
Yeah, I saw that. I got to figure out how I can do some of this precepting.
Yeah, they're going to come to you because guess what? The nurse practitioner school from Fresno Pacific, and there's another school. They're sending their nurse practitioners and PAs here, and guess where they want to be. So I like it.
Get them on some night shifts.
Yeah, there you go. And they can't do that. And our CNO or COO, I think this Karen, you can set that up because I put out an email and said I would love to do it.
Please see some patients.
Yeah.
Okay, what would you say to colleagues or other docs or professionals who maybe haven't had a big scare, or maybe don't take care of themselves so well, what would you say?
Focus on you. Focus on you. Make sure you take care of yourself, because you can't take care of others if you're not there. You have to take care of, if you're not there, you need to take care of yourself. Have a goal. One of my colleagues told me that, slow down and just take everything in, because you're not going to get that day back. You're not going to get that time back. Just take it in. The hospital will still be standing. Trust me, the clinic will still be standing, whether you're there or not, but your family, other people will not be there. And reach out to those that are around you for support, because they're there as your sounding boards. Not everybody, because people have agendas and they may not be that supportive for you, and you'll find that out. But your closest support, your faith, a pastor, a best friend, a wife, a girlfriend, somebody that you can lean on, because you're going to have your ups and downs and your emotions. You need to reach out, and don't be afraid to do that. We're all human, and it's just healthy for you to do that. Is
that what you would have told yourself maybe 10 or 15 years ago?
I would have during med school, where you kind of figure, I can't show weakness, because if you show weakness, someone else is going to get that, Probably during residency, because at MLK it was very competitive. Very competitive, cutthroat, especially in surgery. But the culture was different from where I came from, Davis, where everything was academic and it was kind of a collegial, where I come into a residency where it is kind of collegial, but it was just a different type of culture. People were just academic. They're kind of, I got the sense is that they want to see you fail. You're going through this ritual.
Trial by fire,
you are
kind of thing. Big time
thrown into a fire. But I learned a lot. And will I do it again? Yes, I'd do it again, because you know what? I learned so much. I learned to have thick skin.
Yeah, I bet.
I learned to apply myself, speak up. That's the other thing. I speak up, and don't be afraid to speak up. I think in medicine, for women in general, it's a little bit more difficult, because we're not taught to speak up.
Yeah, talk to me a little bit about your experience as a
woman in
female
medicine.
physician. Yeah.
It's been challenging.
What is challenging?
What's challenging is some of the attitudes that your predecessors may have, and how they perceive you as, you want to be a mom, or you have this obligation, or maybe it's that time of the month. That's the other thing that gets you. You're so emotional. Maybe it's that time of the month. No, that kind of thing, and outspoken. I had a colleague that told me at one point, who was my medical director at the time, told me that I was an angry black woman. I came off as an angry black woman because I voiced my opinion, and I still voice my opinion. I do. If I have an opinion, I want to be heard. And it's not that I'm trying to go over everyone. I have an opinion, and my opinion is just as important as X's opinion over here. And I have an opinion. And I have a thought on that too. If we're in a meeting, I have a thought on that too.
I will say that on a lot of these emails that you've sent out, a lot of the things that you've said, I haven't had the balls to say, and I'm like, I'm glad she said that. Somebody needed to say, we're not doing that anymore. We shouldn't be doing that. I was like, good for you.
Yeah, I have a voice, and sometimes I have to tone it down.
But you were a director before, you're experienced, how this stuff goes.
Yes, I do. And you have to be.
You're not just somebody who's just
waving the flag or whatnot.
Yeah, no.
If something is not, and you don't always have to go with the flow, because if these people over here feel that I'm going with this because this person is doing it, and you may say, hey, wait a minute, that's not right for me, or what we're doing here. I see something going on. Maybe we can tweak it. And they go look at you and, oh no, you're way over here. We don't agree with that. So you're ousted. And I do know, like you said, I had 2 colleagues that I work with in another group that would comment and feel the same way, but would not dare tell that person. Or tell these people, because that's just not how the group was going.
Right.
And will swear up and down that they deny it if I say anything. I'm like, why don't you just speak up? if you don't feel that that's right for the group, or maybe the practice that you're giving, at that time the scenario is different, or could they didn't speak up? I'm going to speak up, but I guess some people just can't do that.
Sometimes we don't know. Like I go from place to place, so I'm like, I don't know how it goes here. I don't know what's business as usual at this hospital.
You have to figure out who the major players are. Well, sometimes it's not good at that, because if right is right, wrong is wrong, or if I see it and I say, you know what, I think it works better this way for me, because this is my experience with this particular thing. What is your experience? For me, I'm respectful. I want to know, what's your experience? Because this is what happened when I did this. What happened when you did that? I'm not trying to shut you down, because this way is right. Mm-hmm. And I've worked with people, this way is right. And particularly males, mm-hmm. who figure this way is right and there's no other way. And no, you're being too emotional.
Kind of closed-minded.
Closed-minded, I'm just right, I had one dress me down in front of nurses and patients in the ER because he felt that his way was the right way and there was no other way. And I said, well, it's not true. We could, have an opinion and we can agree to disagree. But that didn't work. I say we could agree to disagree, because I see we're not going to make any headway here.
Yeah.
But that didn't work. He tended to follow me around to different rooms, to the point where I had broken down and started crying and wanted to leave my shift. Had to go into the break room, had to leave my shift. And I told him, you find someone else to work for me, because I can't have you walking around behind me, yelling at me, telling me that, this is the way it's going to, this type. And eventually he apologized, because he couldn't find anybody else to work that shift, and he wasn't going to work it, And I went out, held my head up, and did my job. Mm-hmm. But that kind of thing, I don't think that would have happened to one of my male colleagues. Taking time out for your kids, having to be somewhere for your child. I don't think you should worry about that. Oh my gosh, I'm going to worry about that because I don't know how they're going to take it. Are they not going to put me on any shifts? Are they going to ask me? That kind of thing. I've seen people worry about that. Mainly females worry about that. Yeah. And it shouldn't be that way. It shouldn't be that way. So if that helps, that's my experience.
This was a great interview. Thank you for doing this.
Oh, well, thank you for asking me.
So I hope everybody gets a lot out of it. Please get back to us with any feedback. It's appreciated. And thanks again.
Thank you.
This was really good.
I'm glad we did it.